We have some questions sent in from the public, so we're just going to go through them and see how we get on.
Okay, very good.
David says there's been an increase in Northern Europeans and Americans coming to Marbella for surgery. Why do you think this might be?
Well, we are in a perfect place to take some days off and come to the beautiful Marbella and to do a hair transplant. You know, this is I think it's a perfect environment. We're in a big hospital, luxury hospital. So when people come from abroad, they can stay here in our place, or they can go to the nearest hotels, that we have plenty. And of course, the VIP service that you have here in Spain, in Marbella, we all talk different languages. We have staff that talks different languages, so they feel very comfortable here. Most of all, we have a lot of hair transplant experience. Of course, we have more than 7,000 surgeries done, both techniques, FUE and FUT, and I think our results are fantastic. Honestly, we have a lot of people recommending themselves.
Yeah, a lot of people come and they recommend their friends, and it just goes on and rolls and rolls.
Mm-hmm.
Yeah, exactly.
Yeah, I think that's the reason why we have more and more patients here. The results are fantastic. The environment is fantastic, and probably it's a little bit cheaper.
Yeah. Well, they are specifically for you. A lot of people come here to have the surgery with you. Why do you think that might be?
We did a couple of famous people.
Yeah.
And so that's the reason why also the profile is going better. Yeah.
When you see the person in the public eye and on the TV, then it highlights the quality of the services that we give.
Yeah, it's a very good, the best option.
Thomas says, what do you think makes a successful hair transplant?
Success, I think it's because we just do hair transplant and hair treatments. So we're dedicated exclusively to that.
Yeah.
So we use the latest technologies, we use the latest instruments, and our obsession for density.
Exactly.
For density and no scarring. It's
because you have so many thousands of surgeries, you're more precise with your hand, whereas other people or doctors, they have a lot of experience in other areas, and they try, but they don't have the amount of surgeries under their belt.
That's impossible. You know, when you have a lot of experience in one thing, of course you're going to do it much better than someone that does many things. You know?
Exactly.
Yeah.
We also have one here from Antonio. You've decided to start a new... Let me start here. Okay, we have something from Antonio here. He says, you've now started to try to help other people less fortunate by starting the main project. Mm-hmm. He wants to know, what was the reason to do this?
Well, we've been doing this hair transplant to people that can't afford it, that they prove that they can't afford it, and there are special cases like hair transplant for scars or birthmarks or things like that. And we've been doing this kind of hair transplant for a long time. We didn't tell anybody, of course, because that's the way you help people, I think. But now we created the main project that is a committee of different specialities. Mm-hmm.
We have dermatologists.
The best of dermatology, the best of plastic surgery, the best lawyer, the best psychiatrist. And we made a team, we made a committee, and that team is going to assess that patient completely, mm-hmm. So we can do that hair transplant, of course. And
it's more of a holistic approach, covering everything. People may need a surgery, but they might not be psychologically prepared for it. So we have to make sure that everything is in place to make that person have the best result and the best for them.
Mm-hmm. Exactly. So that's the main project, yeah.
He also says there's a lot of negative press at the moment with hair transplant. And why do you think that might be? the results and things like this. People are more conscientious and they want to know more from the doctor about the surgery. That makes them quite nervous. Why do you think that is?
Well, what happened was that a long time ago, when this started, when hair transplant started, everybody was doing it, again, the same plastic surgeons, dermatologists, other doctors. And the problem was that they didn't have the practice, enough practice. They were doing one or, for example, 2 a year. So that makes your team is not capable of doing it perfectly. The doctor doesn't have the experience to do it. And we fought a lot. The people that, like me, that are dedicated exclusively to hair, we fought a lot during a lot of years in the International Society of Hair Restoration to upgrade the profile of the hair transplant surgeon. And now suddenly it's happening again, just because of the economics and the situation. So we have low-cost hair transplants and all that. And again, the profile is coming down again for hair transplant doctors, but because there are new doctors without the experience, just with the objective of making money, and that's what you have to be aware of. So you have to look for the doctor that has the most experience, and the team, that doctor has the team that works every day, that do surgery every day like us. I don't have any other doctors in my team. I'm the only responsible for the results. And I have, of course, a perfect team that helps me do this surgery.
That's a good, important thing to think about, because a lot of people go for consultations in a generic clinic and they don't know who the doctor is. They forget to ask, and they don't ask how many surgeries he's done or who his technicians are, because the technicians, as I know, do a majority of the work as well. So these things have to be asked, because if you don't ask them, you're not going to know what you're getting. You may see pictures of before and afters, but was that pictures of before and afters of that doctor or the one that was there 2 years ago?
Yeah,
maybe
price can never be
no, it's not a
item
marker
of decision.
Exactly.
If you're going to do your hair transplant, no, what you have to decide is who's going to be the doctor. Make sure that he shows your results, that you see the place, that it's going to be in a hospital or a clinic, and all those things. Yeah, and you're going to be the only patient of the day, of course, that we do. We just do one patient a day to dedicate exclusively to that patient, to guarantee the results, of course.
The last question is, if you have people from far away that don't live in Spain, like the UK, how do you consult with them?
People can do an online quote by sending pictures. Another thing that we can do is an online consultation through Skype or FaceTime. And that gives us enough information to make a quote. Of course, we're going to need to see him face to face to either make that quote better or,
change
certify
the technique
it.
or whatever. Yeah.
But we can make an approach, first approach, online, of course, or phone call, pictures, of course, Skype, FaceTime. And then, of course, we are in a hospital, so the patients can stay here if they come from abroad, or they can choose any of the other partners that we have in hotels around us. Yeah.